Hi, welcome to Case of the Day. This is Wednesday, and so we have our 58th case, and it's titled Excessive Dynamic Airway Collapse. This 80-year-old had COVID 19 and 22. There is persistent dyspnea, and you see these curvilinear opacities that are very typical of COVID 19 lung sequelae, and maybe I'll do a post about this sometime as to how we're still seeing some patients who have this so called long COVID. But today it's not about that. The expiratory images showed almost complete obliteration of the tracheal lumen. And you can see that the anterior convexity is maintained at really posterior wall collapsibility. There was a scan done 18 months prior which shows similar findings, both in the lungs as far as the interstitial lesions are concerned, as well as the tracheal changes. Now, I tried to do some minips, and you can see the significant reduction in caliber. But to understand how its posterior wall, and I tried to do some 3D images, not very successful, but you can see the on the expiratory how the posterior wall just caves in, whereas here, of course, it's round all through. And that explains this entity where there is posterior wall collapsibility. Now, I did a bronchomalacia post tuberculous about 2 or 3 weeks ago. And at that time, I referenced this article, which is really the main article in radiographics that explains all of these concepts, where basically we have the broad category called expiratory central airway collapse, which has two subtypes: tracheobronchomalacia, where both walls collapse, and excessive dynamic airway collapse, where the anterior wall remains convex, and these are all these conditions that cause it. So in our patient, the anterior wall remains anteriorly convex, but the posterior wall collapses, suggesting that this is EDAC rather than tracheomalacia, though the clinical significance remains uncertain. So to summarize, it's not difficult to diagnose ECAC if both inspiratory and expiratory scans are available. And we can differentiate between the two subtypes, tracheomalacia and EDAC, depending upon whether the anterior tracheal wall collapses, in which case it's tracheomalacia, or whether it remains convex, in which case it is EDAC. That's my WhatsApp channel. Thank you so much for viewing this.